David M. Shavelle, Director of the Department of Cardiology and Director of the Cardiac Catheterization Laboratories at the MemorialCare Heart and Vascular Institute at Long Beach Medical Center. So there's different areas in cardiology, and those can be broken down into general cardiology, interventional cardiology, heart failure, imaging, etc. So interventional cardiology really refers to doing procedures, really non-surgical procedures, whether it be fixing a blockage in the heart with a coronary stent or fixing a heart valve. Yeah, so all patients with valve disease are evaluated, and some patients may be better served with a percutaneous or interventional cardiology approach. The two main conditions that we treat are aortic stenosis, which is narrowing of the aortic valve, and mitral regurgitation, which is a leaky mitral valve. So the MitraClip is a procedure that's done without surgery. It's a non-surgical procedure. It involves placing a small device on the leaflets of the mitral valve. This device is referred to as a clip, which is a small little metal implant, and that clip secures the anterior and the posterior leaflets of the valve together to prevent leaking of the valve. The procedure is done in a procedure room with an anesthesiologist. All the work is done through a small hole in the femoral vein, which is a vessel in the leg. And we also do the procedure with imaging that involves a transesophageal echo machine that's placed down a patient's throat. Procedure takes approximately 1 hour. Sometimes it's faster, sometimes it's longer. Patients typically stay in the hospital one night and typically will go home the following day. Most patients that are receiving the MitraClip procedure, they tend to be older, they tend to be less healthy, and they tend to not be candidates for traditional open heart surgery or even minimally invasive open heart surgery. And so those patients are evaluated in our valve clinic, and if we think they'd be better served with a non-surgical approach, we would offer them MitraClip. Patients typically come in the outpatient setting, stay one night, and leave the next day. Typically the day following the procedure and the next days to weeks after the procedure, the patients will tend to feel better. They'll have more energy, their breathing will be better, their quality of life has improved. Most patients with mitral regurgitation, which is this leaky valve, most patients will have shortness of breath, impaired exercise capacity, meaning they can't walk as well as they would want to walk, a lack of energy, fatigue. Some patients will have palpitations or a racing heart. Some patients will have swelling in their legs. Those symptoms are consistent with congestive heart failure. Typically after the procedure, those symptoms will tend to get better. As I said, they can get better in a day or two, but after the procedure, patients tend to have a slow and consistent improvement in their symptoms. So patients, for example, could be walking a half a block and be limited by shortness of breath. After the procedure, they'll walk 2 to 3 blocks and really have no shortness of breath. So the valve clinic's an actual clinic, so we have clinic space, and we typically will have patients come, and the patients that we like to see in the clinic are patients with some form of valve disease. The two most common are aortic stenosis and mitral regurgitation, but there's other patients with other valve conditions that we evaluate. We have the patients come in. Patients are evaluated by a team of doctors that includes interventional cardiologists, general cardiologists, imaging specialists, and cardiothoracic surgeons. We also have 2 valve coordinators that will help patients navigate this whole process. So the patients are evaluated, a history is taken, patients are examined, and then during the clinic we look at all the imaging studies that have been done on the patients. Chest x-rays, EKGs, ultrasound, echo tests, maybe heart catheterization. And once we reviewed all that information and discussed with the patient and family members, we'll give the patient our recommendations about the best form of therapy. Patients then may accept that form of therapy, or patients may have additional questions, and patients may have their own bias about what they think would suit them better, and then we'll have a discussion about that. So the purpose of Valve Clinic is doing what we call a multidisciplinary team approach, where everybody on the team is there, and there's open discussion about what we think is the best for a particular patient. So I think it is a little bit unique to have this type of clinic in a community hospital. We're a large community hospital. It's really based on what was done at university hospitals and university settings. But we think by bringing all these specialists together in one setting and bringing the patient in, we can provide better care, probably a tailored approach for each individual patient. So for any patient or family members that are interested in coming to the Valve Clinic, the phone number is 562 933-3370. They can also go to our website, memorialcare.org/LB Heart.